Hi Cindy, how are you feeling today?
I've been good, thanks. Just waiting for baby to come.
Oh, that's good. How are baby's movements?
They're good. He's kicking normally.
And are you having any bleeding, contractions, or have your waters broken?
I've been having the occasional Braxton Hicks, but no bleeding or waters broken. So
That's good to hear. So the point of this appointment today is to discuss having an induction of labour since you're 41 weeks. We recommend this because beyond 41 weeks, the placenta doesn't work as effectively. Have you heard of or understand what an induction of labour is?
Not in great depth. Could you explain what it is?
Yeah, of course I can. So an induction of labour is where we assess your cervix to determine if your body is ready for labour. At every stage, we would ensure that you have full understanding and informed consent at every stage. Prior to the induction of labour, we would assess your cervix via an examination to assess how many centimeters you're dilated, how soft, and the position of your cervix. To determine a Bishop score. If your cervix has not softened or ripened yet, we would introduce a medication known as diazepam, which comes in two forms, Cindy, and in this case, we're using Cervidil. Cervidil is a form of induction of labour which is inserted into your uterus, which helps to soften and ripen your cervix to prepare it for labour. It's inserted behind your cervix, which slowly releases the medication to help your cervix soften and dilate. This stays in your cervix for about 12 hours, and after the 12 hours, we would do a vaginal examination with your consent. The next process is to wait 30 minutes as per policy before we can insert a sterile small tool known as an amni hook to gently break your waters. This alone can help you progress into labour naturally.
Does the process hurt the baby?
No, not at all. So it is completely safe. We will continue to monitor our baby's heart well-being at every stage during the process. If your contractions have not started yet, we would begin by augmenting your labor with a medication known as oxytocin, which helps your uterus to contract. This is given intravenously.
I've heard that it can be intense. Is that true?
Some women experience intense contractions from the oxytocin drip. However, midwives would discuss different types of pain relief, such as the epidural, the gas, being in the water. We would adjust the rate of the oxytocin to help establish regular and strong contractions and monitor you throughout the whole process. When you're on a drip, we will continue to monitor you as well as baby's heart rate through something known as the CTG. Are you familiar with that?
Yeah.
Okay.
How long does an induction take?
That's a really good question. So it really depends on your body and how it responds to the medication. So it can take time. With the Cervidil, it takes about 12 hours for the medication to help soften and dilate your cervix. And after 12 hours, we would remove the Cervidil like a tampon, and we would wait 30 minutes before we reassess and break the waters as per protocol. And with the oxytocin drip, it can take around 1 to 4 hours for your body to begin having and developing regular and strong contractions. As for a first-time mom, you may dilate 1 centimeter every 1 to 2 hours. For example, when you're 2 centimeters, it could take up to 16 hours for your body to be fully dilated at 10 centimeters. Then when you're in second and third stage, which is when you're actively pushing and birthing your placenta, it can take around 1 to 3 hours. But I want you to know that every woman is different and the experience are different. So it just all depends.
Oh wow, thank you for addressing that. So what are the side effects of these medications?
So with the diazepam or Cervidil medication, some minor side effects include nausea and vomiting, which we can give you a medication called Zofran to help you manage that. You may experience occasional diarrhea due to the relaxation of your smooth muscle, but at every stage we would ensure that you're adequately hydrated and are comfortable. With the relaxation of smooth muscles, you also may experience the occasional cramping, so we can offer you Panadol for any discomfort you may have. And the major side effects is called hyperstimulation, which occurs when you have more than 5 contractions with less than a 90-second break in a 10-minute window, which can cause distress to the baby. So if that was the case, we would remove the pessary to hold contractions, and we would continuously and closely monitor both you and baby. If the hyperstimulations continue with the removal of the pessary, we would give you a medication known as a tocolytic, which is used to help stop contractions. If the contractions have settled down and both you and baby are well, we would proceed with caution. But I want you to know at every stage, We would continuously monitor you and baby through the CTG. Oxytocin causes similar side effects, such as the Cervidil, such as vomiting and diarrhea, which we would manage with anti-nausea medication and Panadol if you experience any stomach pains or a headache. Similarly, if you experience hyperstimulation, we would halt the oxytocin drip to stop the contractions and give you a tocolytic if needed. During the stages, we would monitor you and both baby very closely to ensure that you're both safe so that this is prevented. We may be adjusting the induction plan, and in rare cases, you may be indicated to have a cesarean birth. But at every stage, we would monitor both you and baby and manage the side effects accordingly.
Okay. Thank you so much for explaining it to me. I feel really well informed.
Yeah, that's okay. We're just here to support you and to make sure you have a positive experience and a positive labor.
Thank you.
That's okay.